brought up 2 points before. One, you said you know that a lot of skiers are coming to Aspen from other areas of the country, which might be at a lower altitude. And there's something that can happen called altitude sickness. Can you explain to us what that is and how you can prevent it? I know you said before start out at a low level, but can you tell us a little bit more about that?
Well, altitude sickness is something that occurs when people who live at lower altitude come to high altitude, and obviously those require some type of definition. But most of the people in the United States live somewhere around sea level or within 1,000 feet of sea level. And high altitude is usually defined as something over 8,000 feet. Now, if you consider that many of the Colorado ski resorts are 8,000 plus feet, and the top of the ski resorts are somewhere around 12,000 feet, then that meets the definition of high altitude for most people. When you come to high altitude, there's a number of physiologic things that occur because of the lack of oxygen, and it takes some time to acclimatize to high altitude. If you ascend too quickly to high altitude, then you can experience something called altitude sickness or acute mountain sickness, where you can have headache, you can have flu-like symptoms, fatigue, etc. Some people will have some stomach upset, but usually they feel quite uncomfortable for only a short period of time, and then it resolves after about 48 hours. Now, if they start having respiratory complaints where they have difficulty breathing, that can be a sign of high-altitude pulmonary edema, which is a life-threatening event where the lungs begin to fill up with water and then can't exchange oxygen anymore. The best treatment for that is to get those patients to lower altitude as soon as possible. There's another phenomenon that can occur that's called high-altitude cerebral edema, and that is also life-threatening. It's quite unusual in the skiing population. It's more common in the mountain climbing population, but people who have prolonged headache, vomiting, changes in their mentation should be seen for that. The best way of avoiding it is avoiding any of these problems, such as altitude sickness, is to ascend slowly to altitude. Some people who come here from low altitude will experience these symptoms immediately, and if they could spend a day or so in Denver, which is below 6,000 feet, then they would actually have fewer risk factors. Taking a day or so when you first get to altitude to take it easy is a very good way of decreasing your risk. Staying well hydrated, drinking lots of fluid is another good way of doing it. Avoiding alcohol, which tends to dehydrate you, is also a good way of helping prevent it. There are certain medications that people can take. Diamox is a medication that's frequently used, but it takes some time to take effect. It works actually by making the blood a little bit more acid. The biggest driver of respiration at altitude is carbon dioxide buildup. And at altitude, you can actually breathe up all your carbon dioxide, but still have an oxygen deficit. And if you sleep like that, then you're much more likely to develop symptoms. So by acidifying the blood a little bit, makes you breathe more when you're sleeping and decreases your risk of having some of these symptoms. But again, it takes a little bit of time for those things